let's finally go through the difference between heart tests so you can easily tell them apart. Hi, I'm Mersad, a nursing expert, and in this video we are going to review heart tests and examination together and see when each one is used. First, the electrocardiogram or ECG. It's a quick and simple test that only requires a few adhesive electrodes on the body. The ECG records the electrical activity of the heart. With it, we can see if the heart rhythm is normal or if there is any arrhythmia and detect signs of a new or previous heart attack. Sometimes it can also show high stress on the heart muscle or enlargement of the chambers. Just remember, the ECG show the heart's condition at the moment, not the overall picture. Next, the exercise test or stress test. In this test, you walk or run on a treadmill while your ECG and blood pressure are continuously monitored. The goal is to see how your heart performs under physical activity. If your coronary arteries are narrowed, oxygen may not reach the heart muscle sufficiency during exercise, causing change in the ECG. So, the stress test is used to detect coronary artery stenosis and assess the heart's physical capacity. Now let's move on to echocardiography or echo. Echo uses sound waves like ultrasound to produce a live image of the heart. With it, the doctor evaluates the heart's pumping strength, checks the valves, and measures the size and thickness of the chambers. If there is fluid around the heart or a congenital defect, echo shows it clearly. In fact, echo gives a live picture of heart function, unlike ECG, which shows electrical signals. Next, let's look at heart blood test. Troponin. This is the most important test for diagnosis a heart attack. When the heart muscle is damaged, troponin is released into the blood. The higher the level, the more severe the damage. After a heart attack, it remains in the blood for about 7 to 10 days. CKMB. This is a specific enzyme from the heart muscle that rises when there is acute damage. It rises earlier than troponin and decreases faster, so it is useful for early diagnosis of a heart attack. Now, the cardiac nuclear scan. In this test, a small low-risk radioactive tracer is injected, and the device shows how blood is distributed in the heart muscle. With this method, we can see which parts of the heart are receiving enough blood and which parts are not functioning properly. For detecting coronary artery stenosis, it is more precise than the exercise test. CT angiography. Here, a contrast agent is injected and a CT scan produces a 3D image of the coronary arteries. The doctor can see precisely whether your arteries are blocked and to what extent. CT angiography is non-invasive, meaning no tubes or catheter need to be inserted into the body. Finally, coronary angiography. This is the most accurate method for detecting artery narrowing. A thin tube is inserting from the arm or leg artery all the way to the heart. A contrast agent is injected and live images of blood flow are seen on the monitor. With angiography, the doctor can determine exactly where the blockage is, how severe it is, and can even open the artery or place a stent right there. So this is not just a test. Sometimes it is a direct treatment. Conclusion: none of these tests alone shows everything. The doctor chooses the right combination depending on your condition to understand exactly how your heart is functioning. This is Medicals, your word of wellness. Thanks for watching. Like and subscribe for more nursing insight, and I'll see you soon.